we will talk about the top 5 causes of eye redness and treatment. Eye redness is a common symptom. It means when the visible white part of the eye, called the sclera, becomes red. It happens because of the dilation of small blood vessels on the sclera.
In the majority of cases, eye redness is associated with other symptoms also because it is a reaction to something and not a condition itself. Irritation, or foreign body sensation, is the almost universal sign associated with red eye. It is a sign of eye surface damage or dryness, which activates nerves and creates discomfort. Itching is the second most common sign, which is associated with a red eye in 60% of red eye cases. Itchiness is a sign of allergy or dryness. The third most common sign is discharge from the eye, called tearing, usually watery, but can be pus-like or mucousy. Is represented in 0.5% of cases and a sign of infection and inflammation. Pain is the fourth most common sign. It can be because of corneal abrasion, uveitis, or glaucoma. Fifth is photophobia, light sensitivity, which is when the cornea or deep structures of the eye is affected. And blurred vision indicates also corneal or internal eye problems.
The first and most common cause of pink eye is conjunctivitis. Conjunctiva is a thin, transparent layer which covers the white part of the eye and the inside of your eyelids. It protects and moistures the eye. Viruses, bacteria, allergens, or irritants like smoke or chemicals can irritate and inflame it. Viral and bacterial conjunctivitis happens with direct exposure to bacteria and viruses. For example, direct touch with contaminated hands, objects, or respiratory droplets.
The hallmark of conjunctivitis is redness due to enlarged blood vessels. Itching, which is a sign of allergic conjunctivitis, discharge, and gritty feeling. It feels like sand in your eye. Watery eyes can be common in case of viral conjunctivitis. And thicker yellow or green discharge in bacterial cases. Mild swelling of the eyelids can occur. And photophobia. Sensitivity to light. Less common, but may occur.
Conjunctivitis usually lasts 1-2 weeks and commonly resolves without treatment. When caused by viruses, bacterial conjunctivitis will not be resolved without treatment in most cases if severe. In mild cases, half of the cases will be resolved without treatment. With antibiotics, it clears up quickly, and allergic persists as long as you are exposed to allergens. Treatment for viral conjunctivitis resolves on its own. Cool compresses and artificial tears can help to soothe the symptoms. In case of bacterial conjunctivitis, antibiotic drops and ointments are usually needed. Usually, polymyxin BE3-methoprene combination is considered, which targets a wide range of bacteria and often is the first line. Moxifloxacin and ofloxacin are also broad spectrum, and 2-bramycin and gentamicin are broad spectrum but less effective. Azithromycin in specific cases, such as chlamydia, for allergic conjunctivitis, antihistamine eye drops like olopatadine are common. Also mast cell stabilizers like cromolyn and cold compresses for relief.
The second most common cause of red eyes is dry eyes. Most commonly happens due to aging when the lacrimal gland function naturally declines. For example, after 50% of the population has dry eyes. Also, meibomian glands decrease function or become blocked, which normally should secrete oil, which films the eye and causes stability of the tear and prevents its rapid evaporation. During aging, it also becomes dysfunctional. Dry eyes can also be caused by prolonged screen use, because during screen use a person blinks their eyes rarely and it causes drying of the eyes. 30% of heavy screen users have dry. Also, other conditions cause dry eyes like windy weather, pollution, and dry climate, Sjogren's syndrome, and medications like antihistamines, anticholinergics, and antidepressants. Keratoconjunctivitis sicca is a medical term for dry eyes. It's specifically this chronic dryness that affects the cornea, kerato, and the conjunctiva. It is often used in medical or clinical settings to emphasize the inflammation or damage caused by severe or prolonged dry eye symptoms.
The most common sign of dry eyes is a sand-like sensation in the eyes, called a burning sensation or foreign body sensation. Tearing can be paradoxical, a reflex due to irritation, and eye fatigue common during prolonged screen usage. In some cases, blurred vision, intermittent, and improves with blinking. It happens because the dry eye surface doesn't provide a smooth optical surface. When it is disrupted, blinking temporarily redistributes the tear film and fills in dry patches on the cornea. This restores clear vision temporarily. The most effective treatment of dry eyes is artificial tears. It is used 4-6 times per day or as needed. If there is a meibomian gland problem specifically, lipid-based eye drops exist, replenishing the oily layer. Warm compresses can unblock meibomian glands and improve oil secretion. Omega-3 fatty acids can improve meibomian gland function. Punctal plugs are inserted into the tear drainage ducts to retain tears on the ocular surface longer. Use the 20-20-20-20 sample when you use a screen. It means every 20 minutes, 20 feet away, look for 20 seconds. Also, if dry eyes are caused by a specific disease or environmental factor, address it. This third most common cause of eye redness is blepharitis. It is the chronic inflammation of the eyelid margins. It is one of the most common causes when chronic eye discomfort overlaps with dry eye syndrome.
Most commonly, acute cases of blepharitis are caused by bacteria, Staphylococcus aureus or Staphylococcus epidermidis, allergies, eyelash mites like Demodex species, and contact lens wear can also cause blepharitis. Symptoms of blepharitis are itching, especially along the eyelid margins, burning or stinging sensations, redness of eyelid margins, and sometimes conjunctiva. Dried flakes or scales at the base of eyelashes, especially in the morning. And foreign body sensation. Dry eye lacks significant crusting or eyelid redness. Treatment is eyelid hygiene, warm compresses. Apply for 5-10 minutes to soften crusts and unblock meibomian glands. Lid scrubs on the eyelid margins with diluted baby shampoo or eyelid cleansers, topical antibiotics, bacitracin or erythromycin ointment, and sometimes in cases of blepharitis or severe cases, oral antibiotics like doxycycline and azithromycin. Artificial tears also help relieve symptoms, manage seborrheic dermatitis or rosacea with appropriate treatments. For example, antifungal shampoos, topical metronidazole. With treatment, most patients achieve significant symptom relief, though recurrence is common. Long-term eyelid hygiene is often required to prevent flares. Untreated cases can cause chronic dry eyes, styes, localized infections, or corneal damage in rare cases. His fourth common cause is subconjunctival hemorrhage, which means small blood vessels rupture in the conjunctiva. It can happen due to different factors like increased pressure from coughing, sneezing, vomiting, or lifting heavy weights. Trauma, such as rubbing the eye, using blood thinners like anticoagulants like warfarin or aspirin, high blood pressure, hypertension, and bleeding disorders. Sometimes it happens with an unknown cause called idiopathic. It is more common in older adults. One of the most common scenarios is in older adults due to hypertension. Commonly there is a bright red, sharply demarcated patch in the sclera. No vision impairment. No discharge or pain. It doesn't cause irritation or light sensitivity. Usually it doesn't require treatment and it will resolve within 1-2 weeks. Cold compresses may help and artificial tears if there is mild irritation. The fifth cause is corneal abrasion. Around 10% of cases of age redness, it is sudden pain, tearing and sensitivity to light sensation called photophobia. Pain is sudden and often described as stabbing pain. Excessive tearing, reflex tearing to flush out the irritant, photophobia, and foreign body sensation prolonging the eye. It happens when the outermost layer of the cornea is damaged and nerve endings are exposed. Most commonly, it happens due to dust, sand, or small particles scratching the corneal surface, poor lens hygiene or overwearing lenses, trauma with fingernails or tree branches or anything else. And dry eye syndrome can increase the risk of corneal abrasion. The most common scenario is contact lens wearers with improper use, or outdoor workers and sports players. Also, children are more likely to accidentally scratch their eye during play. Diagnosis is made with a special dye applied to the eye, which highlights the abrasion under cobalt blue light, called fluorescein staining. Treatment is topical antibiotics, for example, erythromycin or polymyxin B ointments. Lubricating eye drops, cyclopentolate drops when pain reduction is needed for relaxing ciliary muscles. Sometimes eye patching is recommended, and discontinuing the use of contact lenses until the abrasion heals. Abrasions will heal within 2-3 days. For larger injuries, within 5 days, there is always a risk of secondary infections and ulceration of the cornea. Scarring may result in long-term vision impairment if the abrasion is deep.